Hello, my name is Molly Hanson. I'm the Health Policy Specialist with Jefferson County Public Health. We appreciate this opportunity to present on a great collaboration across Jefferson County Public Health and the Colorado School of Public Health. And I'm going to be presenting with two of my colleagues. I'll let them introduce themselves really quickly.
I am Marin. I work as an epidemiologist in Jefferson County Public Health.
Hi, and I'm Holly Wolf, coordinating the efforts of the students in CBH in helping this project.
Great, and we also, it was an oversight on my part, we appreciate the partnership also with the Center for Public Health Practice. I neglected to mention them or reference them on the slide, so we do really, I apologize for that oversight. Okay, so a quick overview of our presentation. So we're going to talk specifically today about the Colorado Public Health Improvement Act. We're going to talk about basically creating a framework for public health excellence in Colorado and how our community health improvement plan fit within that context of that framework. We'll talk specifically about the community health assessment and the great collaboration with the School of Public Health and how that fit into our community health improvement plan. We'll talk about the co-benefits across the two agencies and partners working on our community health assessment and our community health improvement plan. And we'll talk about the next steps about related to our community health improvement plan. So I'm going to turn it over to Anna now, and she's going to talk a little bit about sort of the larger context of our community health improvement plan here in the state of Colorado.
Okay, so this all started because there was a Senate bill passed in 2008 called the Colorado Public Health Reauthorization Act, which required all local public health agencies across Colorado to create a community health improvement plan. And that was headed through the Colorado Department of Public Health, the Office of Planning Partnerships, and they developed this system called CHAPS, and basically that is just the guidelines that help us, the locals, follow so that we are actually within the law on that SB 194. The interesting piece about this is that this also maps really well with the voluntary public health accreditation, and it is a requirement. So because CHIPs are best public health practice, it's also a requirement in order to apply for accreditation. Accreditation is voluntary, but we hope that we can apply within the next couple of years.
So we're going to talk now just a little bit. Can I see a show of hands? Have any of you been engaged in your community health improvement plan, either professionally or through your local community? Great, wonderful, wonderful. So really quickly, I think it's very important to talk a little bit about Jefferson County. This work is obviously embedded within the community. So I'd like to talk a little bit about Jefferson County. We are a community of about 535,000 people. We are located west of Denver. Does anyone live in Jefferson County or work there? Great. So it's a very diverse community. We know that there are mountain communities. We have Wheat Ridge and Lakewood and Arvada. We have a shifting and changing demographic. We have quite a bit of needs. So creating a 3 to 5 year community health improvement plan for a very large county with diverse needs has been a challenge. So engaging with our partners and our community to create a 5-year plan has been exciting, but it's also been a lot of work. So really quickly, as we started the process, we identified some priorities. We know we wanted to use a participatory process. We knew engaging our community partners to create new allies and new partners across different systems was important. Because once we did our community health assessment and once we identified strategies, we knew we had to engage our partners to actually implement the strategies for change. We knew we wanted to focus on the social determinants of health, some of those root causes or drivers of poor health. We knew we had limited resources, so we focused primarily on secondary data. We obviously wanted to look at population needs, so how to address strategies that were evidence-based and that really focused on policy environments and systems for collective impact. And obviously community engagement was so very important to gather those new allies, to get input about prioritization, and for the selection of strategies, metrics, and indicators. So now I'm going to turn it back over to Anna.
So everything started by creating internally what we call a steering committee, and those were representatives from all of our divisions, so they were our staff members, to ask them about what they were seeing. They obviously touch the community because they provide services, so we wanted to know what the community that we were serving looked like. And we also initiated key partnerships with the Colorado Department of Public Health and with the School of Public Health. And the work that we did with the School of Public Health was really important because it really helped us gather some of that support that we needed to build capacity that we didn't have at the time, to collaborate with some of the qualitative data analysis, and to help us also engage the community. Like Molly had said, that was one of our primary focuses through this process. Are we going backwards? Oh, yep. Thank you. We're doing yeah. No, that was fine. And we started by having a student, so a PhD candidate, Erin Seedorf, helped us at the very beginning of this process, and her help was very tremendously of help because we ended up having her help us engage some of the community partners. She actually met with our leadership. She met with some of the non-for-profit hospital to help us make the business case of why the importance of their requirement to build what they call a community health needs assessment. That's very similar to the CHIP, and how that was very important that they partnered with the public health department because we were engaging in very similar processes. She also helped with technical assistance, and one of the biggest things that Erin helped us with was to engage executives across the county that touched health to form what we call the Health Council. And the Health Council is all executives from all sorts of areas that touch public health, anything from from economic development to the hospitals, to the local healthcare providers, to parks and recreation. I mean, really, really broad. And they come together and they're meeting every 3 months, so every quarter, and they're meeting about this plan, and they're helping us inform the plan. And Erin was essential to form that partnership with outside agencies. So I realize you can't read this. This is a little busy slide, but I wanted to show you that this is a process that had lots of steps. We're actually in the last one, step number 9. And there's a little box right there on your left that says Colorado School of Public Health, and that's where you guys, the Colorado School of Public Health, kind of inserted itself into our process. And I will go ahead and pass it to Holly.
Okay, so we brought in students from the community health assessment class, a group of 10 different students, to do a very intensive project over a 4-month period of time. And it had basically 5 different components from the groups that were working on the project. So first, there were several groups that were carrying out secondary data analysis. And that secondary data analysis and development of simple ways to communicate the results of that data included working with demographic data to describe the population, looking at morbidity and mortality data, most importantly from the standpoint of what were the risk factors associated with that disease to be consistent with the intent of Jefferson County as far as their improvement plan, and also looking at prior assessments and reports that had done to look for trends and themes and changes that were occurring in the community. An additional activity that we carried out was to use qualitative data techniques in terms of key informant interviews and a nominal group technique to help Jefferson County engage their own employees in this process. And we held a community engagement where we had about 55 people from the department who brainstormed what were the health concerns and then did a preliminary ranking of them and then asked who wanted to continue to be involved. And as we were doing these projects, we were using the work processes that had been identified by JEFCO as part of defining how they were going to operate for their accreditation. So written communications and assuring that we were carrying out evaluations of any sort of activity that we carried out so that they knew then whether they could carry those forward or not and continue to use them. Oops. We're consistent at least as far as that. Okay. So the information that was collected from those two major activities then was used to make a presentation to the internal steering committee. And that included the simple data presentations and carrying out then a prioritization exercise using a modified Hanlon technique that ranked the concerns based in terms of magnitude, severity, and feasibility. And I just, again, this is not to overwhelm you, but those 4 different major activities that we carried out identified these 16 different areas of concern for Jefferson County. And the prioritization section then allowed those to be reduced and ranked. And then the results of this ranking was presented to the Board of Health relative to the community health process, and then carrying that forward. In addition to then, that information was also used to carry out additional interviews with external partners and people who are living in Jefferson County to initiate obtaining that community engagement. Okay. There we go.
How are we doing on time? Okay, great. So now we're going to talk a little bit about some of the co-benefits across Jefferson County Public Health and the Colorado School of Public Health related to this partnership. So one of the things we talked about was the importance of the translation of quality analysis techniques in a local process. So really what happened was it sort of set a norm or a standard for how we were going to continue to do community engagement and prioritization within Jefferson County Public Health, specifically within our CHIP. So it really, this partnership with the Center for Public Health Practice and with the school built capacity of the staff, obviously. It set a norm or standard, as I mentioned. It supported meaningful engagement. So we knew we wanted to engage with the community and with various stakeholders at lots of different points in time. So we wanted to make sure that we used a rigorous scientific method to really capture prioritization. So it was very helpful, and we continue to use these processes when we identify priorities, gaps, and barriers. It made the work more fun. It was just a pleasure. We worked with student groups and staff and faculty, and it was really just quite a bit of, it was just really quite pleasurable. It was meaningful, and it was a very collaborative experience. So now I'm going to turn it back over to Holly, and she's going to talk about some of the benefits
for the school.
For the school, yes.
Okay, so I've got these simplified down. One of the factors that is very important for Judy and I is to take the techniques and methods that have been developed and used to support research and to actually apply those in the real world. And that's not only a matter of us applying them from the school standpoint, but to develop the capacity in both the local public health agencies and in the communities so that they can continue to use those methodologies. So beyond carrying out the student projects, we've delivered a number of training sessions around specific techniques so that groups, in fact, feel that they have ownership. And I think, as Molly's indicated, that worked well for them in terms of the partnership. The other key aspect of, from the standpoint, my standpoint of being the school, is how do we develop workforce capacity? Not only of the students that we have going through our programs, whether that's undergraduates, masters, or doctoral students, but also how do we indeed be accessible and assure that the knowledge that we have can be used to improve public health and our community practice. And this expands not only from the public health department, but now to all of the external partners, which we have defined as part of the public health workforce, like the hospitals, like mental health, like the education system. And I think that the example that we're providing you shows that, in fact, that is possible to do.
Okay, very quickly I'll go over this. The next step, so we have continued to move forward with the process. We released the community health assessment in May of 2013, so this year in May. We continue to do constituent engagement, so we've had community meetings. We continue to invite people to our health council so that we have a broad multi-sector representation, and we will continue to move forward with this process. We hope that we can build a very strong community health improvement plan that's supported by the community and that is implemented by not just the health department, but all of our community partners, so that it is really a public health system approach.
Great. And just really quickly, currently we are engaged in creating 2 work groups. So we went through an additional prioritization process in July and August. And now we have 2 priority work groups, one on healthy eating and one of active living. And just a quick picture, because we obviously feel community engagement is so important. Finally, we felt community engagement and outreach was important, especially through our variety of partners that might not be able to come to meetings, engage in the process actually in person. So we have a website. We encourage you all to go to it. You can actually download or look at our community health assessment, and you can actually sign up for continual updates for our community health improvement plan. So, the website is actually Healthy People, Healthy Places, Jeffco. So thank you so much. I think we have maybe just a moment for questions. I kind of rushed these guys along so that we would have a couple of minutes for questions. So we do have a few minutes. Yes.
So, yeah, I have a question. It has to do with how you would encourage other faculty to get involved in this sort of experience in other places across the state. Whoever wants to take that.
Do it from your end.
Well, I mean, I think one of the first things is to contact your local public health agency and find out in the community that you live what stage they are in their community health improvement plan. If they're in prioritization or if they're moving towards implementation of their community health improvement plan, everyone lives in a local community. So I think that might be the first step. Do you have any other suggestions?
I think what we've been trying to do through the Center for Public Health Practice and also Community and Behavioral Health is to encourage groups who would like to partner with us to provide the opportunity for students, whether it's practicum, capstone, formal classes. This is occurring now also in terms of environmental and occupational health. It's occurring in terms of evaluation. But the message, I guess, that I'd like to provide is this isn't just a short-term going in and doing something. It's actually building that partnership. So the initial activities with Jefferson County in exploring how could we complement what they were doing started about a year ahead of time so that we could in the school understand what their philosophy was and make sure as we were helping them with their projects that we were true to their culture. And too often a technique or a method might not fit, so that it takes a lot of creativity in making that happen.
So I actually have the pleasure of overseeing a Live Well community initiative and also a cancer, cardiovascular, pulmonary disease grant, which is Amendment 35, to look at policy environments and systems to address healthy communities. So worksite wellness is definitely a strategy that we've looked at, obviously, within Live Well Wheat Ridge and within the CCPD grant. We actually did a data collection in the first year of the grant to look at policy environments and systems at work sites. We did a worksite wellness scan for our 50 largest employers, and that is actually a data input in our next stage of our CHIP. As we choose strategies, metrics, and indicators, we will obviously be addressing worksite wellness, and we have invited economic development and the business community to be a part of our work groups now. So it's a strategy that we pursue and we plan to grow in the future. Is that helpful?